I am Dr. Sundeep Lakhtakia, Senior Consultant Gastroenterologist at Asian Institute of Gastroenterology at AIG Hospitals, Hyderabad. And with me is Dr. Radhika Chavan, Consultant Gastroenterologist at Asian Institute of Gastroenterology. Together, we shall discuss the study titled Impact of Transmural Plastic Stent on Recurrence of Pancreatic Fluid Collection after Metal Stent Removal in Disconnected Pancreatic Duct, a randomized controlled trial. This study has recently been accepted in prestigious journal Endoscopy. Dr. Radhika is the principal investigator of this randomized controlled trial. Radhika, let me ask you the first question. Why did you do this study? What was your motivation?
Thank you, Dr. Sundeep. Disconnected pancreatic duct is a topic for a debate for many gastroenterologists and those who are dealing with a pancreatitis and its complication. Disconnected pancreatic duct is very common in wall of necrosis and is major risk factor for recurrent pancreatic fluid collection. Indwelling plastic stent has shown to reduce the rate of recurrent pancreatic fluid collection in patient with a disconnected pancreatic duct. Nowadays, large caliber metalstent are used for the management of wall of necrosis. But unlike the plastic stent, metalstent has to be removed because of associated adverse event with a longer placement. So what is the rate of recurrent pancreatic fluid collection and what is the effect of exchanging plastic stent with a metal stent on the recurrent pancreatic fluid collection in a patient with a disconnected pancreatic duct? So to address this question, we have conducted a randomized control trial aiming to compare exchange of plastic stent with a metal stent versus no stent on the incidence of recurrent pancreatic fluid collection in a patient with disconnected pancreatic duct after large caliber metal stent removal.
Thank you, Radhika. That was very comprehensive. So you showed the study design of placing plastic stent in one arm and no stent in the other arm after removal of metal stents in all the patients who presented with disconnected pancreatic duct on imaging. So can you highlight what was the major outcome of the study?
The primary outcome of the study was to see recurrent pancreatic fluid collection at 3 months. So total 6 patients had recurrences at 3 months, 3 in the stent group and 3 in the no stent group. And as per intention to treat analysis and as per protocol analysis, it was not statistically significant. Secondary outcomes were like technical success of a plastic stent deployment were seen in a 46 patient and plastic stent migration were seen in a 10 patient at a median period of 8 months. Recurrent pancreatic fluid collection at 6 months were seen in a 7 patient in a stent group and 10 patient in a no stent group. And at 1 year, it was seen in a 7 patient in a stent group and 13 patient in a no stent group. Though there were more recurrences in a no stent group compared to stent group, it was not statistically significant. And out of 20 patients with a recurrent pancreatic fluid collection, only 7 patients underwent reintervention.
So outcome of this study is likely to fill the knowledge gap in our understanding about pancreatic fluid reoccurrence, pancreatic fluid collection reoccurrence when the LAMS or the large caliber metal stent is replaced with a plastic or not in the patients when we are treating them with disconnected pancreatic duct. So what I foresee the next steps in this direction of managing a disconnected pancreatic duct in a setting of patients who have been managed with large caliber metal stents. In this study, we did not find a significant improvement or a prevention of recurrence of pancreatic fluid collection at 1 year. So this challenges the current practice that we follow, or most centers in the world follow, that is of replacing a metal with a plastic and leaving them permanently in situ. What we would suggest now based on this study is to remove the metal stent and follow up these patients, because Those who develop a collection subsequently can then be managed by endoscopic treatment if they are symptomatic, and those who have a collection, if they are asymptomatic, can be followed just like that. So this outcome endorses the strategy of avoiding placing a plastic stent as a replacement of LCMS. Radhika, I would like to request you to summarize and conclude this study.
So to conclude, replacement of large caliber metal stent with a plastic stent does not significantly reduces the development of recurrent pancreatic fluid collection in patient with a disconnected pancreatic duct. Majority of recurrences are asymptomatic and hence do not require reintervention.
Thank you, Radhika. That was a clear message. I would like at this time to thank all my co-authors for the contributions in preparing the manuscript and helping us way. And I would also like to thank the journal Endoscopy for accepting our paper for publication.